Hello.
Happy New Year.
Happy New Year. Here we are again, infant feeding team, and it is the beginning of January. Hope you all had a really good Christmas and New Year, and some of you got out and did things, or you're safe and you didn't catch COVID. We're all okay here. It's business as usual in the hospital, and cases are coming and going, but it's all fine. So this is our infant feeding session. I'm Naomi, this is Alex. And we do a questions and answers session. If you haven't been part of this before, welcome. And we invite you to put questions down there, and we answer them as they come in, and hopefully help you with some things that are concerning you, worries that you've got. So not necessarily individual cases we'll be talking about, but obviously if it's personal to you, you can put a general comment on and question and ask us about stuff. We're very happy to get you to call us if it's a little bit more complicated, and we'll have a conversation with you on the phone, or
Absolutely.
we can hopefully get you back on track if you're having problems. And if you're not having problems and things went well, or things didn't go well and then went well, then let us know, because that's really encouraging for other mums that are struggling at this time, that have had a difficult few weeks, maybe.
Absolutely.
Newborn baby, they just think that it's never ending. Let us know how it was for you, so that they can hear the positive sides of it as well, because everybody starts in a position where they it's an unknown, and feeding is not always easy for people. It is a skill that you've got to learn, and it's like having a new dance partner, isn't it? So think of Strictly and think what everyone's like in September, and look at the ones that have got to the final in a few months, how they've managed to become really good dancers. So it's just the same, you're learning a skill together, and if one of you knows what you're doing, it makes it a bit easier. If both of you do, it really does, and if neither of you know, then that's where you sometimes come a cropper.
And also sometimes you can have, as we've had, we see often, mums can have 1 or 2 babies and everything goes really well, and then another baby comes along and it's totally pear-shaped, and that's not uncommon as well. And it is, as Naomi says, it's a new dance partner, so but it can be all sorts of things. For there can be, for instance, we talk about it quite often, tongue tie, and actually that can make a huge difference if you've fed 2 babies before. And when we have mothers contact us and say, I've fed babies before, I'm feeding this 3rd baby, someone suggested it might be tongue tied, it really is terrible, I'm having a terrible time, then actually that's often a time where we'll think, this is more than likely that's what it's going to be, because
experienced mothers,
they're experienced breastfeeding mums, and we've seen that, and I've seen a mother with this issue today.
So and I have 2 actually, and I had a mum who had her first baby was tongue tied, and then her next baby wasn't, and then this one is. And she knew that it was exactly the same, and she got exactly the same problems that she had with the one that was tongue-tied, so she knew straight away, apart from the fact she could see it, but she was right. So it's not never compare your babies though. When you have your first baby and then you have your second baby, don't compare what your first baby did with your second one with feeding, because they are different people and you've got different skills this time, and you may have breastfed your baby for quite a long time, and then you are plonking your large baby on your breast for quite some time, so you might be feeding a toddler and you just sit there and don't think about it, and then you have a newborn baby and you sit there just like you don't notice, and suddenly you've got sore nipples. So it's really important that you do go back to basics when you do when you have your next baby, because it's very easy to just plonk them on and think it's going to be okay, and it isn't. You've got to really think hard again, and your breast's a different shape, your baby's mouth's a different shape, everything's different with your second baby, so, and your 3rd baby. So make sure that you do go back to basic and get help if it's not quite right.
Especially because with a newborn baby, you've got to be in charge of getting the baby in the right place. When you get to babies that are much older, that are really putting themselves on and can feed in any position, and they're doing breastfeeding gymnastics by then, that isn't an issue, that baby will put themselves on and get themselves in the position they want to be. But when you've got a newborn, it is very much your role to bring the baby on in the best position possible for that baby, and that means bringing them in close, and it's like having them tucked in under your arm like a set of bagpipes, and not having them hanging off like a toddler. So
you really tuck them in round into the contours of your body. You don't want them over here somewhere. No. And you don't want to have your baby sort of like this, where it's nosediving and you're putting the breast in its mouth. You really need to tuck them into the contours of your rib cage and tuck their feet round you. Support the back of their head, back of the shoulders, sort of at the back of their neck. A bit like going to the hairdressers, Alex says, when you get your hair washed. You know, it's that sort of basin that you're looking at, and that supports. So you don't want to be doing this. You want to have your baby's head free, because if you can't put your baby's head back, if it can't extend its head back, it won't open its mouth. So a lot of mums come and say their babies aren't gaping, and it's often because they're holding the head, or they're supporting their head like this when they're feeding, and so the baby goes forwards on to its nose. So when you're feeding the baby, it sort of goes in like that onto the breast, and what you want it to do is go up like that. So it's, you know, it's that action versus that action. And so when you've got your hand on the back of the shoulders and then on the back of the neck, the baby extends its shoulders right out, and then the chin goes up. And when the chin extends up, it makes the baby gape, and then it also goes meh. The tongue comes right out when it does that. It sort of does that, and that then elicits a gape. So you're lining your baby up well, and you're doing nose to nipple, so that your baby isn't central to the breast. It's asymmetrical, and that's where you want your baby to go onto the breast, with its shoulders opened up and its chin going forwards, and then it will get onto the breast in the right position, and will ensure that feeding is good. So we look at this picture all the time, and it's lining your baby up. We do this time and time again. We show these pictures to you because you can't get it, you can't do it enough to get it right, because it's so crucial to your feeding experience. So always line them up really well, and then when they gape, as you can see, their head is back, their head is free from the hands, and the chin hits the breast first, and that nipple just skims the gum ridge at the top of the roof of the top of the baby's mouth, and then it slides across the sort of the hard palate right to the back of the throat, and you get a really big mouthful of breast, and then it can milk the breast and get the milk out. There's a different picture there that you might be able to see in a different angle, and you really need to elicit that in order to get good positioning. And if you get that, and if you can just get the baby in the right place, then everything else falls into place and it works well. So just make sure that you bring your baby really close, and you see how that baby's nose is free, the chin is close, and you can't really see much around the baby's mouth. And if it feels right, it probably is. You don't need to pull it out to check. So you don't need to be like this, looking to see where your baby's mouth is when you've got your baby on the breast properly. Anything else to add to that?
No, I think that was great. Absolutely great. We've got two comments.
Basic. And I think the other thing to say is, if you've got 4 babies, make sure you give yourself time to feed the newborn, because you're so busy a lot of the time that you're on off, catching toddlers running around, going to school, coming back, picking up, doing clubs, putting to bed, reading stories, making supper, and actually you're not actually feeding your baby for long enough. So just make sure you give your newborn baby enough food, because quite often they're on and off the breast frequently and they don't actually finish a feed, and then you find that they're not settled or they're not gaining weight, but actually sometimes it's because you're not managing to give them a long enough feed for them to transfer milk and get a good feed. So really, if you can, field babies out for a bit, or children out for a bit, to share school runs and things, if you're really struggling to get your babies to feed properly, just for a few weeks, to see if you can just protect your supply and make sure your babies transfer enough milk and gain enough weight.
Brilliant.
You've got 2 questions, and
we've had 3 now. Fine.
Excellent.
It's not a problem. Michelle has put, hello, my baby is almost 9 months old and has recently started biting when breastfeeding. How can I stop this? So it is a phase, isn't it? It passes. Actually, amazing enough, we always talk about positioning attachment. It's the answer to everything. Making sure that bottom, that when the baby goes on, that their tongue is over that bottom lip, really helps. Keeping their chin in against the breast, they're not just hanging off the breast, may help too. It is really hard not to react, when you're bitten, because those teeth are so, and 9 months really they will, they are so sharp, and it is very difficult not to react. And I think there are different schools of thought as to whether you take them off and say no, or you try and ignore it as much as you can. But making sure you've got baby really on close, keep that chin really in, they're more likely to not do it. It is developmental. Many babies will do it, unfortunately. Anything to add to that?
I think, as you said, just don't react to it. It's really hard not to.
Really hard.
It's just absolutely. I mean, I was lucky my babies didn't get teeth till they were about 11 months. So, but you know, when they are teething, they do lots of biting, don't they? And you know, can they have things that they can sort of chew on instead when they're not feeding, just so that they you know, can. I used to give mine frubes, frozen frubes. So you know, if they're 9 months, they can have things like that. They can, can't they? I think they can have the frozen yogurts, can't they? And Tommy Frays. And I used to freeze the frubes and give them those to bite and suck on, just to let them do that a little bit. But I think don't react to it, because that is a game then. And if they do keep doing it, then yes, some people do say take them off and put them into the middle of the room and walk away, and they won't do it again, because they, you know, but that's not everybody's way of doing things. So it you know, depends on your baby and how you feel about that, because it's quite an aggressive form of thing to do, really, is to put your baby down and walk away from it. But sometimes mums have done that and they've said it's worked and stopped their babies biting.
It often comes toward the end of a feed, so if you think that, you know, it might be happening, you think that we're getting near the end of the feed, they're getting a bit fidgety, you know, maybe just taking them off. You know, cool. Some mums choose to have some really sort of elaborate necklaces. You used to make them out of cotton reels and things like that, but you can buy them now. Something to keep them entertained and to reach out for, which might keep them not thinking about biting. So, because they are getting to that point in time where they're very aware of everything around them.
So life's a big game at 9 months, isn't it?
But it is so painful, and I really feel for you, Michelle, because my children got teeth at 6 months, and they certainly did bite. And it is very. I mean, I know that I did take them off and put them down, because I wouldn't walk away, but it is so painful. You can't help but yelp. So I'm going to really hope.
It's a really hard one, but you know, struggle through, because they will stop doing it when they get to the next bit.
Definitely a phase. Definitely, it will pass.
Yeah. Good luck.
Yeah. Charlotte said, "Hiya, Happy New Year. Alicia's asleep, not watching today. How does she get Elisha to walk with her feet pointing forward rather than sideways?"
You won't be able to do that. She'll do it when she's ready to. It's her way of balancing, isn't it?
They have an interesting way of walking when they first start to walk. So.
Like little
but how wonderful that she's doing it. How lovely. Laura has said, "I've read that when they do that, it's because they're not hungry. They kind of play like that." So we're talking about the biting, but when they're hungry, they get straight down to business. There is that too, and I also think it does happen toward the end of feeds when they get, again, is that they're not so hungry, and it's a bit like, oh, you know, I'm there, my teeth are aggravating me. So.
But you know, it is more than food. Breastfeeding is more than food, so it's part of their development is that they have that contact with you, and you know, the suckling and the comfort in their mouth other than food. So it, you know, it's not just a feeding pastime. Breastfeeding, it's for everything, meeting your baby's needs. So you know, it develops their oral cavity, it widens the palate, it, you know, helps dental spacing, it develops speech, and you know, all the things that they need to grow up with. Plus, you know, the brain growth and all of the hormone things that you get, the happy hormone things, oxytocin, all that closeness. It's all of those things. So it's security, it's boredom, it's all of that. So yes, it isn't about food, but it is part of their development as well. And I think sometimes they do it deliberately to see how far they can put you, you know, and it's not because they're being spiteful, it's just that they're exploring life and they know that they get a reaction. So it's everything all in one, breastfeeding, and that comes with it.
That's a very good point though, Laura. That was
absolutely
great to add that on. Alexandra has said, "Hi ladies, we started using a sippy cup yesterday. Baby takes it fine and drinks from it, but then spits it all up. Is this typical? She's 9 months now and drinking fine from the breast. Fairly typical." Yeah. But she'll get it in the end.
Yeah, I think if you're breastfeeding, she's getting plenty of nutrition and fluids from your breast milk at the breast. So just let her experiment with it.
Yeah.
Well done.
Yeah,
that's an exciting time, isn't
it?
it?
To go on a sippy cup.
Grown-up baby.
We talk about that quite a lot on here, trying to get them on something else, which is quite funny. She'll work it out. So, Emma has said, "I'm due any day now. I've packed my hospital bag, but is Nipple Cream something that I need to use straight away? Thank you." that's very much what happens. We really hope you won't need it. We hope that stays in the packet and you'll never need it. So, but you could pop it in your bag. It's not going to take much room.
It's quite soothing, isn't
yeah,
it?
Yeah. You know, breastfeeding. I had a conversation this morning with a mum in clinic, and we were talking about it being painful. Breastfeeding, when you do it, we would say you describe it as powerful. So you know, babies have a powerful suck because they have to, because it's for their survival. It's important that they can remove milk from the breast. However, it shouldn't be painful, and we always go on about positioning and attachment. We talk about it all, you know, a lot, and we've already talked about it today. And the whole thing about it is, have you got that breast? Is thinking about making sure. Naomi talked about that asymmetrical attachment, and if this is the baby's mouth, the nipple wants to go right at the top, as you saw in that picture, because it then takes the nipple right to the back of the mouth. So at the back of your mouth, if you take your tongue back, you'll feel what's called your soft palate. So you've got your hard palate here, and then your soft palate here, and that's like a soft cushion for your nipple to be, your nipple to be against in the baby's mouth. So when the baby takes the nipple in right at the top of the mouth, they use their tongue and they take it back onto the soft palate, and then the baby feeds by moving its tongue up and down the breast on the areola. The areola can cope with that, but you can imagine hard palate, rasping tongue, your nipple can't. And that's why mums get sore. So it is positioning and attachment. On a few occasions, it's something else. It may be the baby has a raised palate or a tongue tie, but more often than not, that's what it is. 99% of the time, it's to do with where has that nipple landed in the baby's mouth. So getting positioning and attachment right from the beginning makes a huge difference. And if you can manage to do that, you won't need your nipple cream.
And you know, I was talking about it this morning, saying that most mums stayed in hospital for 5 days, you know, and in that time you got breastfeeding support, and your milk came in, and your breasts were full, and you learnt to deal with all of those things with supervision. So people came and helped, and there was more time, and you know, it was a very different time. But you know, mums want to go home really quickly now. They don't want to stay in because it's noisy, and they want to be with their partners. But actually, there was a lot to say for having that support and making sure that you've got really good positioning, and you've got over that second night, which we talk about a lot, isn't it?
Yeah,
where
absolutely.
they're really they do grow horns, you know, the second night after you've had your baby, and it tends to be the night you go home is when you think you haven't got enough milk, because your baby is chasing the milk. They're feeding, and they don't stop, and you just think, well, I haven't got enough, and you send your partner out to buy other milks, or you know, you're on the phone to people saying, I can't do this, and if your positioning is poor and they're doing that on the second night, you're going to get very, very sore, and then that makes it really stressful for you. So I think it's getting that positioning really well established as often as you can before you go home. So practice feeding. You know, don't give your baby anything other than your colostrum in the early days, so that you're not making your baby get more sleepy. You want your baby to be waking up and feeding frequently if you can, so that you get lots of practice and lots of help. And if your baby's not doing that because you've given other foods, or you know, sometimes you've been medicated in labour, your baby's more sleepy, you don't get the chance to practice in the same way and get the positioning and attachment support. I think the other thing is you have to ask for it. Nobody's going to come up and ask you if you need breastfeeding support, because they're running around. As you know, if you've been here on the wards, that you know, it is very busy and there's an awful lot of people, but if you ring your bell and ask for help, they will come and get it, but they don't know if you need that help unless you ask. So make sure you ask, make sure you get it right, and make sure you feed your baby frequently. So put your baby skin to skin. Don't leave him or her in the cot wrapped up next to the radiator, because that will really make your baby sleep after a long birth. And just make sure you practice lots. Do lots and lots and lots of hand expressing, and if you do that, your milk will come in more quickly, and then when your baby does grow horns on the second night, the amount of colostrum and the transitional milk will start to manifest itself more quickly, and your baby will get food more quickly, which means they're not feeding quite so frequently and quite so vigorously for so long if you've got full breasts, because then the milk just falls into their mouth. So you know, the more you stimulate, the more skin you do in the first 2 or 3 days, the more likely you are to have milk when your baby really needs it, and that stops the constant feeding where they're chasing the milk if it's a bit late coming. And if your milk doesn't come in till day 4 or day 5, there's a lot of feeding going on with not much rest between, because they're chasing the milk and wanting it. So, you know, it's all about that first feed in the first hour, and the skin to skin in the first hour that sets that process going, that ensures that you get enough milk when your baby really, really needs it, which then reduces the number of feeds that your baby will have later on as your time goes on, and the amount of feeding goes up, and that means that your breast is being used more. And so getting it right is really, really important for all of those reasons. Was that nipple cream, that question?
That was the question. I was going to say, so Emma, if you've got it, drop it in your bag. If you haven't, don't worry, because we do have Gelinet on the wards, and we can give you something if you are sore on the ward. So, you know, if you have, drop it in. Otherwise, don't worry. But remember that if you are sore, and this is for everybody, if you are sore, it's likely to be positioning and attachment. Get some help. And
you know, it's healing by moisture, so that's why we use the nipple cream and lanolin type based creams, because you know, it allows that moisture to stop your nipples from drying out or getting scabby.
Yeah, treat them like your lips.
Yeah.
So, Michelle's come back. Another question from me. My sister's pregnant with her first. She found breastfeeding biscuits useful. Do you recommend these, and if so, any particular recipes? I think, to be honest,
that with oats and things? Is that what you're talking about? I must be.
Don't know.
I mean, who knows? Things like tiger milk, people talk about sometimes, don't they? Using brewer's yeast and things like that. But it's anecdotal, a lot of it. You know, it's not guaranteed.
The thing that really, really works is milk removal. The thing that drives milk supply is milk removal. If you don't remove the milk from the breast frequently and from the beginning, then you're not going to have a milk supply. That makes the biggest difference. So mothers,
you know, if you replace the feeds with bottles, or you sleep longer and don't feed your baby,
or you've done antenatal colostrum harvesting, which lots of mums are doing these days, but don't feel obliged if you haven't, and you've brought it in and you've used that and you haven't expressed instead at that point in time, then your body doesn't know the baby's here and needs to be making milk. So the most important thing is frequent milk removal from as soon as the baby is born will drive the milk supply better than anything else.
And I think things like herbal supplements, you know, be very careful. They are, you know, plant derivatives, and plant derivatives are drugs as well. So, you know, it is essentially a medication, and it isn't monitored at all.
No.
And a lot aren't licensed. But things like fenugreek, which people go to the, you know, to buy to get more milk sometimes, is actually quite toxic in volume. So you have to be very careful when you're taking things like fenugreek, that it has got quite a high lactation risk. That means quite a lot of it goes through breast milk, and so your baby gets quite high levels of it, and actually that's not what you want. So you have to be very careful when you're taking anything, when you're breastfeeding, that it's done safely and in moderation if you are doing it, and you know what you're taking, and that it is actually okay to take when you breastfeed, because all herbs are, you know, derivatives of plants, and medications made from plants. So, you know, it's not harmless. So be very careful when you're looking at all these things, because sometimes, you know, it's not the best thing to do. And as Alex said, take milk out, you'll make more.
That's the best way of getting your milk supply up,
and
more than any of these things. So, but just to say that, you know, if any of you are on medications, this doesn't mean you can't breastfeed. So, you know, we know that there are a few medications, just a few, that are contraindicated to breastfeeding. The majority of medications are just fine. Some of our mothers who go through Silver Star, they're the more complex mums and maybe on a cocktail of medications. We would probably look into that and just make sure that the combination of medications is fine. But for the majority of people, there are no concerns with most medications. If you are worried, you could either contact us or look at the Breastfeeding Network to see whether it's appropriate for you to be taking a particular medication. But the majority of the time, it's fine.
You know, even things like anaesthetics, if you need an operation, for instance, you know, mostly they're all fine. All the medications, all the pain relief that they give you, you know, it's a lot of the medications that we look at that aren't so good are things like chemotherapy and antipsychotic medications, but the majority of them are okay, but you have to check, obviously, And most medical practitioners that write prescriptions will check whether it's safe to take when you're breastfeeding, and they will give you an alternative to the one that they think is to be prescribed. There is often an alternative that they can use which is breastfeeding friendly. So if a GP says, well, you can't breastfeed when you're on this medication, just make sure that you check that it is right, because sometimes you can breastfeed with them, and the drug companies will say not suitable for breastfeeding because they're covering their generic drug as a whole. But actually, when you look at the safety aspect of it, and we've got extra sort of publications that we can check with, and pharmacists that we check with that are specialists on breastfeeding, they come back to us usually, and we can see in the books that we've got that actually it is okay to breastfeed with those medications. So always check first before you stop taking that medication or you stop breastfeeding, because it probably is okay to breastfeed.
Brilliant. So Laura's come back. She said, hello, just wanted to say a big thank you to the team. I had a very rough start after a traumatic birth experience due to medical negligence. And in addition to my baby having tongue tie, the team were awesome. Very helpful and patient. Emma and I are doing great. She keeps breastfeeding at night. She's 9 months now. Isn't that lovely? Really
That's
brilliant.
exactly what we love to hear, to encourage other mums as well. And I'm so pleased that you've moved forwards and had a positive out of all of that. So well done you.
Shelley said, hi ladies, baby's 4 weeks today, had lots of wonderful support from Emma at Cotswold Birth Centre. I feel latch is now good and it doesn't hurt to feed, and she's gaining weight, pooping well, brilliant. However, the last few days nipples are very sore and tender between feeds. Any idea why this has come on? Any advice to help with the tenderness? Thank you. 4 weeks, not got a period, could be that. So,
She's got slightly bigger. It might be that you've just slipped back into some of the old habits that you had. I would revisit your positioning and attachment.
I'm putting my thumb to my nose again. Remember to start nose to nipple. Even when you've got a bigger baby, you might start with a little baby like this, but as the baby gets bigger, they've got to keep coming round you this way. We don't put them this way. They've got to always start nose to nipple regardless of how big they are. So they're going to come round. So it's just remembering that side of it. So that might be the thing to look at. If your periods are starting, you might have a bit of breast tenderness. Some women do, although it might be quite early at 4 weeks for you if you're fully breastfeeding. But it is one of the things that sometimes happens.
You haven't got thrush or anything like that. It's quite unusual to have thrush in your baby's mouth, but sometimes it happens. Or thrush on your nipples if you've had antibiotics, or you've had thrush yourself. Sometimes that happens. I think talk to us if it's not getting any better. And the other thing is, try and use your local services. Is there health visitor support that you can get local to you? That there may be somebody that can come and support you if there's a nurse in the community that works with the health visitors, whether she can come and see you feeding. But certainly OBS is great for that as well.
Yeah.
They've got Zoom classes that they can do, but also there are face-to-face ones. The nearest one to you will be in Kidlington if you're in Chippy, and that is appointment, so you book onto the Oxfordshire Breastfeeding Support. They've got a website, they've got a Facebook page, and you can make an appointment with them as well to just get your positioning and attachment checked. But if you're up against a wall with that, then give us a call and see if we can put you into a clinic and see. But actually, it sounds like positioning and attachment. So hopefully we can get you sorted.
Brilliant. Good luck with that, Shelley. Leanne has said, hello, I get bad eczema, so my nipples are constantly sore and weeping. Is it okay to use hydrocortisone cream before the baby's born? Before I start breastfeeding, will it affect anything?
I think you have to be careful with the medications that you have.
Yeah.
I think you need to have a conversation with your GP. Do you have a dermatologist that you're seeing as well because of your eczema? It is something that mums do struggle with when they're breastfeeding sometimes, but it's probably a good idea to get it cleared up before you have your baby, so that it's under control before you start breastfeeding. And check with us with the medication that you've got, the creams that you've got, to make sure that they are okay. And some mums do use some when they are breastfeeding as well. But it's there's lots of different ones that are prescribed. So I think it's as a needs to know basis. But I would say if you're if you've been using them in pregnancy, then they're the ones that are safe for you in pregnancy. Then they would be all right to use on your nipples, but check with your GP and see if there's anything else you can have just to make it better. Alex is typing
I was just wondering,
frantically to have a little look.
I was going to have a look at Breastfeeding Network.
Yeah, it's worth looking at BFN, Breastfeeding Network, and just seeing, looking at the drugs in breast milk and just seeing.
Yeah, they've got a leaflet.
So they've got a leaflet on it.
Right, so have a look at Breastfeeding Network. They've got a leaflet and it will say about the different medications. Breastfeeding Network is one of the organisations that we were referring to when it comes to medications. It's been headed up by Dr. Wendy Jones, who's a specialist pharmacist in maternity, well, particularly lactation, and she's got a team now working for her because she's taking a bit of a more of a back seat. But this will be all evidence based on here. So she's got all about different creams, steroid creams. So she's written, steroid creams can be applied to areas of eczema on other parts of the body during breastfeeding. Low potency steroids such as hydrocortisone are preferred on the nipple to avoid thinning of the skin. So there is something, but I would highly recommend, you can just literally put a search in, Breastfeeding Network eczema, and their info sheet will come up and you'll be able to have a look. And it's quite useful then because you'll be able to go and have a chat with your GP about the medications and take that leaflet with you, because it is evidence-based, up-to-date, and it's highly reliable. Yeah. So,
and try and get it resolved and under control so that it's not flaring up and weeping when you get to having your newborn, because that will really trigger tenderness if it's already sore. So you really want to try and sort that out if you can, and call us if you've got problems when you've had your baby as well. Ask for infant feeding support when you come onto the ward with breastfeeding if it's still a problem, and we'll support you.
All the best with that. Alice has said, my 11-week-old has started to scratch my breasts and come on and off towards the end of a feed. I was wondering if this was because she was trying to get more in frustration or has found her hands. Also, as she's currently only really going to sleep when feeding at times, I can't always offer the second side. Is that likely to be a problem with my supply? Thank you.
Well, I think getting to 11 weeks, your baby has a bit of a sort of a change in their growth, and they do quite a lot of real frequent feeding. Have you started on a contraceptive pill or anything like that recently? Have you had periods recently? Are you ovulating? At the time, do you notice that your supply changes at different times of the month? Because all of those things can affect it, but also that your baby's needs are changing a little bit. And I think when they are pulling at the breast a bit, it's sometimes to do with flow. I don't know if you've introduced any bottles recently, whether they're having a bottle at night or anything like that. I don't know, did you say exclusive feeding?
Didn't say specifically.
So
no.
I mean, if you've introduced bottles, sometimes they learn that the flow from the breast is not the same as from the bottle, and they get a little bit cross when they start to recognise the difference between the flow in the bottle. The bottle gives you a constant flow all the way through the feed, whereas the breast gives you a big flow and then it reduces as the feed goes on. And babies learn that that the flow changes. So sometimes you can do something like compressions when she starts to get cross. So when she's suckling and starts to get a little bit unsettled, then you can hold your breast and squeeze it, and then when she pauses, you stop, and then you compress, and then pause when she does, and that stimulates more letdown, so it gives them more of a milk ejection into their mouth, so they get another hit, but it also increases the flow. So it's almost like a bottle while you're breastfeeding. You're increasing that flow. It also does increase your milk volume, so it steps it up. And you might find that sort of in the next week or so that she starts waking and feeding more at night as well, and that's just a natural growth development. And actually the feeding that you do in the first 2 weeks is your calibration period for 12 weeks time, and that's your body is calibrating what your babies are going to need as per your baby and the request they put in the early days for when your baby's 12 weeks old. So all the feeding that you're doing, everything that you're doing all the way through, your baby is calibrating for their needs when they may need more milk, and this is the time when they do need lots of milk. They need lots of flow. They have this developmental stage, and so that might be what you're coming up to in this time. So try doing some compressions, that might help.
Yeah.
If you are giving bottles, you know, do they need to have them? It might be that this just gets her through the difficult patch if she doesn't need it, you know, just to not give them for a bit, and you know, see if that changes her behaviour. I think it's really tough time when they do that, but it could be many things that are happening, and you know, it might be one of those things that I've suggested that you're experiencing. It is hard when they do that, but it's often the flow changes. For some reason, something's changed in the way that she's getting milk, and that could be a number of things.
Brilliant.
Come back to us if you've got any more questions on that one. Charlotte's
put another post up. She's thinking about having another baby, and she'll be worrying about the first scan after what happened before, and I totally understand that. She's saying Elisha's being funny with food again, so trying so hard to try and get her to eat normal food. Any tips? Don't make a fuss about it. I think we had this conversation before. Just don't make a fuss. The less fuss you can make about it, the better. Just give her the foods, let her see what she wants to do. And the less fuss we can make about things, the better in that respect. My mother always used to say it was the one area a child had control over, and it was very difficult because they haven't got control over much of their lives, but they have got control over what they put in their mouths, and it's a great way of challenging your parents by not putting much in sometimes. So anyway, good luck with that, Charlotte. So Mina has said, Happy New Year. My baby girl is 11 weeks old and I have 2 questions. One, we've worked on positioning attachment a lot, but unfortunately I still have sore nipples, and I've been told my baby girl's suckle is very powerful, and also composition of my milk is fatty, which might contribute to pain. Is this possible? I believe my milk letdown is also painful, so unfortunately haven't been experiencing a pain-free breastfeeding. I really don't want to just accept that this journey has to be painful for me. Any suggestions? And the question 2 is, I've expressed a lot in the first couple of weeks to increase my supply, and I've got a stock of precious milk in the freezer. Would that still be good for my baby's needs, for example, 6 months down the line? Yes, it would be brilliant. It does change. The composition of the milk changes throughout the time that you're feeding, but it's still fabulous. If you think about when we offer babies on our neonatal unit and on our postnatal wards donated breast milk, those babies may be 4 and 5 and 6 months old, and yet we're giving this to babies on our wards on the neonatal unit within hours and weeks of their birth. So it's always fabulous, your milk. So that I think question 2, we can just say yes, it's wonderful, your milk, regardless of when you expressed it. It'll be fabulous for your baby, so do by all means use it. Going back to your first question, you've worked on positioning and attachment, but you're still sore. You've been told it's your girl's suckle. Well, as we mentioned it right at the beginning, that's really important, that your baby has a really good, strong suck. That is a life-saving device. It's important that they do. The key thing is making sure that they do it in such a way that it doesn't hurt you. So when you say you've worked on positioning attachment, has anybody watched you? I wonder if it would be worth getting an appointment with someone to see what you're doing, to see if they can help you. We always say as a team that there's always room for improvement. No matter how hard you work on feeding, there will always be some room for improvement, and it might be a millimetre.
It's so subtle.
Yeah, just a millimetre of a change. It could be something as so simple as maybe you just move your breast at the last minute and you don't even realise. And that's actually, even if you've got someone to film you feeding, putting your baby on, sometimes that reveals what's happening in a way that you just don't pick up on when you're doing it. But I would highly recommend you get someone to watch, because it's important she has a strong suck. That's not a negative, that's a big positive. We just need to make sure it's being used in the right way.
It shouldn't be sore. You shouldn't be experiencing pain at 3 months. It should be a pleasant experience for you. You know, do get something like OBS would be great, or you know, the Health Vista team, again, close to you. They may have somebody that can watch your baby feed and get support. La Leche League, they're, you know, great for support as well. And it may be that you know, OBS can do a Zoom if they're not near you. Have a look and see if you're living anywhere near any of the clinics that they do, because they are doing face-to-face now, but you have to make an appointment. but they may be able to watch you feed your baby and just make some adjustments to that, and that might help.
And the Abingdon Breastfeeding Cafe is also available. It runs on a Thursday, so and you can book for that one as well. So it would be booking for OBS or Abingdon Baby Cafe or Breastfeeding Cafe. So those are options for you and your health visitor. And you also mentioned about the composition of your milk. You're saying it was fatty. So the fat content in your milk is the most variable changeable composition wise of any part of your milk. So we know that come the evening, when mums often feel like they don't have much milk, the composition of the milk in the evening is predominantly fat. So there's a huge amount of fat in a small amount of milk in the evenings. It's really common for mums to say, I don't feel I have any milk in the evenings. Many mothers find they do have less milk in the evenings, but what they do have is really, really high fat. But that should not contribute to you being sore. That shouldn't make any difference, on whether you're sore or not sore. So I would say that with regard to the suck, that's a good thing, but we need to make sure it's right. And the fat, I don't think that would be contributing to your soreness at all. It is constantly changing. It's really normal.
Different at night and different in the mornings, and your baby tanks up in the evening to have it so you've got less volume but more fat. That's how it is. And it changes all day. Yeah. But it shouldn't make you sore.
No. So I think an appointment with OBS or Abingdon Baby Cafe or with your health visitor would be the best thing to do. Yeah. And that milk that you've already got stored, make the most of it, use it up. Yeah. That'd be fantastic.
Well done for getting so far with all those problems.
Amy has come on. Her son is now 15 months. Now you're the oldest today. Still
all old babies today,
lovely.
Aren't they?
Still breast on the day, occasional feeds. Has started biting quite a lot. Currently had a bad bite that's pretty sore on the preferred breast. I've recently possibly considered weaning him off completely, but I know he still loves the bonding, etc. as do I, especially when poorly. Any tips?
Well, the same as the one that we spoke to at the beginning.
Yeah, we talked about the.
Go back to the beginning.
It was one of the
first questions we had, and we did quite a bit on biting at that point. So it might be worth listening back to that rather than going through it all again, because it is a phase that they do go through, and sometimes they do use it to get a reaction, not to manipulate you, just to get a reaction because they think it's funny when you shriek. Just make sure, go back and have a little listen to what we said, and if it's still being a problem, then talk to somebody else. La Leche League, they've got sort of older baby groups that you can talk to. They're really great on things like tandem feeding and all of those things that older babies do with their new babies, and if you're pregnant and breastfeeding and things like that. So you might find them very, very helpful resource because it's peer support, and they often will have experienced some of those things, and will tell you what was helpful for them. So I would try those resources, listen to what we said earlier, and see how you get on. But it is awful when they do that. I mean, it is so sore, especially if they've got lots of teeth when they're 15 months.
Amy, you've put on here that we're specialised for newborns. We're not. We're very happy to talk to anybody a baby of any age. Unfortunately, we're not able to see babies of over 6 weeks in our breastfeeding clinic, but we regularly talk to mothers with babies that are older than that. Yeah. So do not worry about contacting us. We're more than happy to answer them. Do it on here or do it on the phone. We'll often talk to mothers and try and point you in the right direction if it's something we can't help with immediately.
But there's a lot of support in the community, and it is all free. We're very lucky in Oxfordshire, aren't we, that we've got, there's 4-5 drop-in clinics that are free, run by lactation consultants, and that's quite a thing, to have access to really, really good breastfeeding support. And then you've got La Leche and things like that on top of it, and the health visitor support, which is, in each area that you work in, they've got support in their local community as well. So find out what's available close to you as well to get that support.
And just picking up on your final comment that you made about you don't really want to stop because of the bonding side of it, especially when he's poorly, and it is the most fantastic mothering tool. he still will get nutritional benefit from being breastfed by you. There is still
Hugely.
benefit. You know, you've still got all that antibody action going on. So, you know, with you, if you've had your COVID vaccination, you're going to be passing that on. If you've been unwell yourself, you're passing that on. If you come in contact with someone who's unwell, you're passing on those antibodies. So don't underestimate how wonderful your milk still is for a 15-month. You know, it's still really, really beneficial. And there are many people out there, you will not see them very openly, many people out there who are feeding babies much older than 15 months. And there are real benefits for that baby and for the mother.
I know when I breastfed my babies beyond 1, you know, they used to, from about 1 to about 18 months, my first baby used to get tummy bugs all the time. It was just his weak thing, and he would catch all sorts of tummy bugs. And I used to breastfeed when he had a tummy bug, because you can't give milk to babies when they've got tummy bugs. It makes them really sicky, but you can keep giving breast milk, and that's their hydration, and it's got all the good salts, and it's got all the elements that they need to you know, keep their hydration going. So you know, even if they are being sick or they've got diarrhea and vomiting bug of any kind, you know, you can still keep breastfeeding them, and it doesn't make them sicker. They may still be sick again, but at least they can hydrate, and you might find that you just spend all day with them breastfeeding and cuddling them, and it's just the most fantastic nutrition for a baby that's not very well, and it's comfort, and it's all of the other things for your baby. But also, you know, if you get it and they've stepped up the breastfeeding, they're protecting the milk supply as well, because it's inevitable, isn't it? When your babies are sick, you get it too. But it is sometimes, some babies just get loads of bugs like that, and others don't get them. So, but it is really nice to know that sort of in that time you're giving so much more protection to them when they're being exposed to more sort of socialising bugs that they haven't perhaps come across at that time. You go back to work, they go to nursery, you go to more toddler groups, they're picking up things and playing and putting them in their mouths. You know, that's all part of it. But that's what breast milk does, it protects them from all of that.
Jenny's put a question on, it's an interesting one. I'm nearing the end of my breastfeeding journey, but just had the COVID booster. How long should I keep going minimum to get her antibodies? Well, you're not supposedly covered until 14 days. So they reckon that you don't really get full cover for the first 14 days. So that would suggest that you'd be ideally not stopping within the 14 days.
Keep going if you can in the pandemic.
Yeah,
you know,
absolutely.
we talked about mums that maybe have just given up when we first had COVID in 2020. You know, to relactate or to keep breastfeeding to protect your babies. So you know, think about not giving up just yet if you can, even if it's just 1 feed a day. You're giving antibodies to your baby, and you know, if you don't want to breastfeed, you could do some pumping for a little while if you felt, and put something in a beaker, you know, so that you're keeping giving that milk to your baby so that they're getting that protection from you all the time. Did you have the vaccine in pregnancy? Because that will have gone through to your baby as well, and they will have got some antibodies, remember that. But we don't know how long that lasts for, but we do know that breast milk transfers antibodies from the mum to the baby, and that's really crucial. So, you know, consider maybe not weaning just yet, and you know, protect your baby.
Right, Jenny, good luck with that.
I don't know if that's the answer you wanted, but you know, keep going as long as you can.
Leanne's just come back and said thank you. That was the question about eczema. Hannah has said, hi, I've just started feeding my baby solid. He was 6 months on the 2nd of January. We tried a couple of times before Christmas, but his reflex was quite strong. Now he mostly just closes his mouth. Any tips? Also, should I be giving him iron supplements as he's not eating yet? So he's 6 months. So are you doing baby-led weaning? Because then they put the food in themselves, and they're totally in control. I mean, as we've said, and others on this, like Charlotte, will have repeated on our behalf, food before 1 is just for fun. So they are learning at the moment. They're learning about food. So, you know, from that point of view, we're not expecting a baby to take big volumes at this stage. They're just learning about how to get it from the front of the mouth to the back of the mouth, learning about texture. Taste is less of an issue, because if your baby's been breastfed, your baby's used to the idea that foods have different tastes, because breast milk's constantly changing in taste. And it is just a top up on what you're giving. So your milk comes first, and then solid foods afterwards. And if you hit rocky road periods, if you get to a point where a baby's not wanting to put anything in their mouth, we'd probably go back to just breastfeeding for a couple of days and then try again. And it might be worth, if you've been using a spoon, that you give one spoon to the baby and you have a spoon so they can try as well, and making sure you've got food out that they can pick up.
Make it a rainbow.
Yeah, absolutely.
Lovely,
Make
bright
it interest.
rainbow food, so it's bright colours and looks tempting, and they can pick out the things that they like the look of. And they can explore with their mouth, and if it goes in and comes out, that's fine, they've explored it.
Yeah.
But don't make a big thing of it, and don't worry, because nutritionally he's getting everything from your breast milk.
Yeah, absolutely, right up to 1. So I think, Hannah, it can feel like 2 steps forward and 1 step back when it comes to weaning and moving on to solid food. So just see each day how it goes, but remember that the main nutrition, as Naomi has said, is from breast milk right up to the first year. Now, with regard to iron supplements, vitamin D is the main one that we're giving for
I think
babies.
if your baby was premature, then they would give your baby supplements. But I think that you've got stores. I think check with your health visitor, because they're very good at knowing all the different things on that one. But I think that I don't think they recommend that babies have iron supplements routinely. If your baby was premature, they may well do that as part of their vitamin drops. But I think that that there is some iron in breast milk. And then once they start weaning, then the foods that they get should have different elements in them. So I think that's based on a normal balanced diet. But do have a conversation with your health visitor as well, or your GP if you're worried. But I don't think it's something that we give to all babies in the first few months of their life. But double check that one.
All right, hope that goes well. Alice has been replying to another question, but she's saying, huge thank you for all your support at the beginning when we had weight loss and supply issues. The pumping saved our breastfeeding journey, along with the nursing supplement and Naomi set us up with. We're so grateful and enjoyed not needing the pump now for a few weeks. That's Alice.
Well done, Alice. That's so nice to hear. It's the only time sometimes we get feedback is when you tell us on Facebook Live, so that's really lovely that I've heard that. That's really good. You've worked so hard, so well done.
Rachel said, hi, if breastfeeding is not possible for whatever reason, will the hospital provide milk? I'm due my second baby in 2 weeks and plan on bringing formula just in case. Now, we do have formula in the hospital. The one thing I'll say is all formulas are the same. We say this all the time now. All formulas are the same. They have the same nutritional value. You do not need to buy the most expensive brands. You're not buying better. You can buy the cheapest brand and it will have the same nutrition by law. So this is, we have to, in the UK, they have to all have the same nutritional value. That's the vitamins, the minerals, the proteins, the fats, etc. So from that point of view, you can buy the cheapest brand out there and you will not be doing your baby a disservice. Now, we do have formula on the wards, so that, if you come in and you want to be formula feeding your baby, we will provide you with formula in the hospital. We don't have all the brands, we have just 3, and that's the option we have. If you wish to bring your own in, then do by all means. It will need to be ready made because we have no facilities to make up powdered formula though. But just to say, and to anyone else who is thinking of introducing formula or is thinking of formula feeding, they are all the same. Do not be hoodwinked into thinking one's better than another.
First Steps Nutrition is a really good resource.
And I was thinking about First Steps Nutrition. It's a fantastic, just literally put that into Google and up it'll come. I was thinking about First Steps Nutrition, Naomi, when you were talking about the rainbow. And actually First Steps Nutrition did a lot of work. The lady who worked for that, set it up, Helen Crawley. She's done a lot of work into formula milks, and there's a whole section on there for parents and a whole section for health professionals, but she also looks at complementary foods, the foods that you give after 6 months. And Naomi said feed the rainbow, and that's what we suggest because babies love it, because they like all the colours. So when you're feeding a baby, you're giving them complementary foods, having an array
really
of different.
Nice palette, yeah.
It's lovely, and that will get the baby engaged. What she proved, Helen Crawley, was when you buy foods, they are all bland. They have lovely bright packages, but the minute you open the package and look inside, they're all bland. So
Beige.
your your parboiled carrot, your piece of avocado is actually going to have a lot more for the baby than necessarily buying something.
Yeah.
So you don't have to go and do wonderful gourmet meals. It can be very, very simple stuff, but colourful.
And I think a lot of the baby food that you get is based on when we weaned our babies.
Yeah,
mine's 30 now. We weaned our babies at 3 months. At 12 weeks, we started giving our babies solids,
which we don't recommend.
We don't recommend that, and we know now. And Alex and I both are racked with guilt because we fed our babies at 3 months on solids, and we know now that they haven't got the enzymes in their tummy to break a lot of those foods down in their tummy. But they didn't have the capacity to take the lumps and the textures that those foods that we give a 6-month-old can. So it was very bland and sloppy food, and it was pureed, and that was the reason why. So babies at 6 months have got far more skill. They can pick things up, they can put things in their own mouths, they can choose things themselves, and they're sitting up properly. And so that it's historical that babies were given this sloppy food because they couldn't deal with anything else. But now we know better, and we're feeding, we're weaning babies at 6 months. They're able to pick and choose their own foods, and they're much better at chewing things. So
cope with lumps.
They cope with the lumps a lot more, and they can push the food in and out of their mouth as they want it. So and they can look at things and pick them up. So it's a very different thing now, where the babies are weaned later. So historically the food is bland for that reason, and sloppy, because the babies weren't really meant to have it.
But as you're weaning at 6 months, it need not be. You can do other things.
Exactly.
Go straight on to
Exactly.
often what parents are eating.
Yeah.
So.
But I think also to know on the ward that if you are breastfeeding and you just want to bring the formula in case, we do offer donor breast milk as well on the ward. So
absolutely.
if you are breastfeeding, you don't necessarily have to give formula. If you're struggling a little bit in the early days, we have got donor breast milk that we can support if your baby needs it medically, and in order to support you to get you through the difficult time. So if you're in for a few days and your baby's on antibiotics or it's under lights and you haven't quite got your milk in, then we do support mums and babies with donor breast milk on the ward, and that's it's offered to all the babies on the ward. So
as long as we've got enough, we first and foremost the donated breast milk is for the neonatal unit, and then if there is sufficient, we have it on the wards, which is brilliant.
So it's not just the option that you have to give formula if feeding's not going well. You can offer donor breast milk while you're in hospital, and that can support your milk production while you're with us. So
I say,
it's not just formula.
So Rachel, it's your second baby, and I think maybe just don't worry about bringing it in, the formula in, because
only another thing to bring.
Yeah, donated will be the first thing we would offer you if you're breastfeeding, and only if you choose then we would make formula milk available. Mina's come back and said, yes, I've been to OBS and they did say it looks good, so it must be a millimetre of a change. Oh, you poor love, Mina. So
keep going.
Yeah. Charlotte said Elisha will be 2 years old in May, which I can't believe how fast the time has gone. I think these chats are so good. That means you joined us when we'd only been doing this for a few weeks, so you really are our longest.
Very worst.
Yeah. So we've gone, because we only started in April 2020.
Yeah.
So
we're almost
amazing.
2 years, aren't we, doing this?
Yeah.
How it's gone quickly.
Hannah said, only tried puree carrot and avocados so far, but plan on giving him some sticks of food soon. That might work really well. The babies love it, and it's nice that you did carrot and avocado because they're both brilliant. So good luck with that, Hannah. She said thank you. Leanne has said, Happy New Year, ladies. Hope you're both well. We are, and it's lovely to see you, Leanne, and I hope Lyra's all right. So I think that's it, and we're at 15:29, unless there's going to be a flurry. Now, I'm not in next week. Sorry, we're having a few weeks where we're not working, so we've got annual leave to take between us. So it'll be no session next week, and then the week after that's me on my own, because you're off then, aren't you? You've got an week's annual leave, so this a few less.
A bit patchy, but catch up on some of our old ones. Think of it as 2:30 on Thursday and look at YouTube and look at some of our old sessions that you might not have seen. They may answer some of the questions that that you've got answered. So catch up on some of those and use those that time as a catching up session.
Or watch our videos, because we did all the videos that you can get, that you can access. If you go onto our web page on the hospital website, all you need to do is do a search OUH maternity feeding, and then there's 7 videos on there, and it covers skin to skin, positioning attachment, how do you know your baby's getting enough milk, and that's where Naomi's skills were fantastic at making up nappies and
mixing foods into nappies.
Yeah, and we did about pumping and bottle feeding and alternative feeding methods, and relationship building and responsiveness. So if you want to know if you want to know why it's so important to give your baby a hug, then it's well worth having a look, you know, why your baby wants to be close to you. And our colleague Elisha did that one, which was great. So Charlotte says she's still learning more and more and just want to be a great mum to Elisha. You are a great mum to Elisha. So, right, well, I think we're going to call it a day. This has not been a flurry. Thank you very much for all your wonderful questions. And
another 2 come. I don't know if 2 came up just then. One thing
hasn't
come in. No. Anyway,
let me just check.
Thank you all for your
I'm sorry if I
continued
have missed them.
support.
Yeah.
And you know, keeping us going through the pandemic as well. Works both ways.
Yeah.
And we look forward to seeing you in a couple of weeks' time.
Yeah, we like the feedback.
You do.
So.
We
All right.
know that you're doing okay. All right. Take
Thank
care.
you.
Have a good
Bye.
week. Bye.